Gentlemen, have you ever wondered if it's safe to kiss down there? Or if that moment could carry HIV risk? Many keep this question to themselves, out of worry, embarrassment, or a memory that still makes the heart race. As a urologist with 2 decades in sexual health, I'll give you a medical breakdown. What is low risk, what raises risk, and the habits that keep you protected without killing intimacy. Before we dive in, hit subscribe. This channel gives clear answers with zero shaming. One subscription fuels this work and helps me reach those who need it most. Mini hook. If you've ever replayed that one time in your head, this next part will settle your nerves. My commitment is simple. We'll use evidence, not fear. We'll identify red flags and pair pleasure with protection using practical steps you can follow tonight. If this topic matters to you, click subscribe and comment safe and smart. It guides my next videos and supports your safety. Stay until the end, and I'll show you the top mistake men make that turns a caring act into irritation, plus an adjustment that makes the experience comfortable, confident, and connecting at any age. Sometimes my patients ask me the same question I once asked my own partner. Doctor, is it dangerous to kiss the private area? It's an honest question, and the answer begins with how HIV truly spreads. HIV needs a very specific environment to survive and enter another body. Transmission requires blood, semen, vaginal fluid, or rectal fluid that carries a high viral load. Those fluids must come in contact with another person's mucous membrane or open wound. That is the biological doorway. Without it, the virus simply cannot pass through intact skin. Now, let's clarify a myth that causes unnecessary fear. Saliva is not a transmission fluid. There are natural enzymes in saliva that actually damage the virus. Even when HIV-positive saliva is tested in laboratories, the viral concentration is too low to infect another person through normal kissing. However, and this is where science adds nuance, there are exceptions. If someone has bleeding gums, oral ulcers, or throat infections, or if there is contact with menstrual blood or genital sores, the protective barrier of the mouth is broken, and risk increases slightly. Similarly, the presence of another sexually transmitted infection such as herpes or syphilis can open micro-wounds invisible to the eye. So, while the general answer is low risk, it is never no risk. Understanding that difference keeps intimacy both safe and realistic. Most people fear saliva, but that's not where the danger really hides. Knowledge, not fear, is what lets you stay close without crossing the line of danger. I once had a 25-year-old ask me in clinic, "Doctor, I enjoy doing this at my age and I want to keep my partner safe. Can I get HIV from it?" Here is the medical answer, based on what major health agencies state. The World Health Organization and the U.S. Centers for Disease Control report no documented cases of HIV transmission from oral sex alone. Risk rises when certain conditions are present: open sores, bleeding gums, throat inflammation, or ejaculation in the mouth. Why those factors matter comes down to biology. HIV needs access to the bloodstream through fragile tissue or an open wound, and it needs enough virus, the viral load, to cross that barrier. Healthy oral tissue plus saliva's antiviral enzymes make transmission highly unlikely under typical circumstances. But low risk is not the same as no risk. If you have mouth ulcers, recent dental work, actively bleeding gums, a sore throat, or another STI that creates micro-tears, the protective lining is compromised. Dry, cracked lips also warrant extra caution. If your partner has a high viral load, or there is semen or menstrual blood involved, the risk increases further. What should a safety-first plan look like? Avoid oral activity during active mouth or throat problems. Use barriers when appropriate. Do not brush or use alcohol mouthwash immediately before or after. And remember that routine testing and effective treatment reduce viral load and protect both partners. Bottom line, The science is reassuring, but it is also precise. Respect the conditions that change the math, and you can keep intimacy confident and informed. It's not saliva that carries risk. It's what travels with it. Many young men tell me, "Doctor, I feel tense when my partner goes there. My body freezes, and I worry she will notice something is wrong." That anxiety is common, and it often drives risky choices done in haste. First, the most overlooked mistake is aggressive mouth cleaning immediately after oral. Brushing, flossing, or using alcohol mouthwash can create micro-tears in the gums and cheeks. Those wounds open a doorway for infectious fluids. Second, avoid intimacy when there is a sore throat, mouth ulcer, cold sore, or tonsil inflammation. Inflamed tissue is fragile, more likely to bleed, and less protective against entry. Third, never assume healthy looking equals safe. You cannot see viral load with the naked eye. Recent exposure, window periods, or untreated STIs can raise risk despite a normal appearance. Consider a real case. A 27-year-old patient rushed to the bathroom to brush after oral because he wanted to be extra clean. His gums bled, his partner ejaculated soon after, and his anxiety spiked. We tested at the correct intervals. Results were negative. The lesson was clear. Cleaning is good, timing and gentleness are essential. Practical guidance. Rinse with water or saline instead of alcohol mouthwash. Delay brushing for several hours. Postpone oral if you or your partner have mouth sores, bleeding gums, or throat infections. Use barriers when appropriate and test on schedule. It's not saliva that carries risk. It's what travels with it. The danger isn't always visible. Sometimes it hides in the smallest wound. If you've made any of these mistakes before, don't panic, just comment, "Now I know," because awareness is the first protection. I often receive countless questions from both men and women about how to protect themselves during oral contact. My answer is always calm, practical, and guided by science, not fear. The first step is physical protection. Use a dental dam or a flavored condom whenever possible. These thin latex barriers prevent contact between mucous membranes, lowering the chance of HIV or other infections passing through microscopic cuts you cannot see. If latex irritates you, polyurethane versions work just as well and are nearly invisible to sensation. Second, protect the mouth before and after intimacy. Do not brush your teeth or use alcohol-based mouthwash immediately before or after oral activity. Brushing scrapes the gums and exposes blood vessels, and alcohol dries delicate tissue. Instead, rinse gently with plain water or saline. If you feel irritation, apply a mild lip balm and let the area heal before any activity resumes. Third, maintain your oral health. Treat ulcers, gum inflammation, and throat infections early. These small problems can become invisible gateways for infection if ignored. Regular dental checkups are part of sexual health, not vanity. Finally, understand the window period. It's the time after possible exposure when a test might still read negative even if infection has occurred. Typically 3 to 6 weeks for modern fourth-generation HIV tests. Testing too early can give false reassurance, so follow the proper schedule. Pleasure and protection can go hand in hand, and when you know these 3 steps, true safety doesn't ruin intimacy. It refines it, giving you freedom to connect without fear. Many young men and women ask me countless questions about oral contact and intimate safety. They whisper their concerns softly, as if ashamed to even ask. But questions like these deserve clear, honest answers, not silence or judgment. So I always respond the same way, through calm medical guidance and practical prevention. The first step is physical protection. Always use a dental dam or flavored condom when performing or receiving oral sex. These thin barriers prevent the direct exchange of fluids that could carry HIV or other infections such as HPV, gonorrhea, or syphilis. Latex is the standard, but polyurethane works equally well for those with allergies. Protection doesn't destroy intimacy. It preserves trust and freedom between partners. The second step is oral care and timing. Never brush your teeth, floss, or use alcohol-based mouthwash right before or immediately after intimacy. Brushing causes tiny abrasions in the gums that create invisible entry points for infection. Alcohol dries and irritates the tissue. Instead, rinse gently with water or saline and allow at least 30 minutes for the mouth to recover. If bleeding occurs, stop and let the tissue heal before resuming any contact. The third step is long-term oral health. Treat mouth ulcers, gum inflammation, and sore throats early. Schedule regular dental checkups. They are part of sexual health, not just appearance. Healthy tissue resists infection far better than irritated tissue. Finally, remember the window period. This is the time after exposure when HIV may not yet appear on tests, usually 3 to 6 weeks. Testing at proper intervals ensures accuracy and peace of mind. Pleasure and protection can go hand in hand if you know these 3 steps. Safety isn't the opposite of intimacy. It's the science that allows love to last. Many couples walk into my office with worried eyes and the same question. Doctor, can we really tell the difference between HIV and other infections? And most of the time, they cannot. Not because they are careless, but because they have been taught fear instead of facts. Fear has a way of growing faster than truth. It spreads through social media, gossip, and even outdated school lessons. People imagine that every oral contact or every kiss could transmit HIV. But science paints a very different picture. HIV is a fragile virus. It cannot survive in the environment of the mouth. Saliva contains powerful enzymes, lysozymes and RNases, that actively break down the virus. When exposed to air, temperature changes, and digestive proteins in saliva, HIV quickly loses its structure and dies. That is why, after decades of global research, no confirmed case of HIV transmission has occurred from kissing alone. However, confusion often comes from mixing HIV with other sexually transmitted infections. Herpes, HPV, and gonorrhea behave very differently. They can survive in saliva, on the skin, or in mucous membranes, and sometimes cause mouth or throat infections. These infections may not be life-threatening like HIV, but they are far more contagious. Understanding this difference is essential. HIV requires blood or genital fluid, while many STIs spread through simple skin-to-skin or saliva contact. So, fear thrives where knowledge is missing. When we replace fear with science, we take back control over our choices, our relationships, and our peace of mind. Fear spreads faster than any virus, and truth is the real cure. Real protection begins not in the bedroom, but in what we believe. What is the question sitting in your mind right now? Let me share a story that may sound familiar. A 26-year-old man came to my clinic 3 days after oral sex with a new partner. He felt fine physically, but his mind raced. He said, "Doctor, I cannot sleep. Did I just ruin my life?" He described what happened. There was no ejaculation in his mouth, no bleeding he could see. But he brushed his teeth right afterward because he wanted to feel clean. Then his gums stung, and panic took over. We started with facts. HIV does not transmit through saliva. Risk rises when there are open sores, bleeding gums, throat infections, or contact with semen or menstrual blood. Brushing immediately can create micro-tears, which is why I advise rinsing with water and waiting. He asked about testing. I gave him a simple roadmap. At 3 to 4 weeks, an RNA or P24 test can detect early infection. At 6 weeks, A fourth-generation combo test is very reliable. At 3 months, a final fourth-generation test confirms the result. He followed the plan. Week 4, RNA negative. Week 6, combo negative. Month 3, confirmatory negative. Every result matched what his true risk suggested from the start: low. But something else changed during those weeks. We replaced fear with knowledge. He learned to avoid brushing or alcohol mouthwash before and after intimacy. He cured a mild gum inflammation with his dentist. He kept saline at home for gentle rinsing. He learned that testing is a tool for clarity, not a sentence of doom. When we reviewed the final negative result, he exhaled deeply. He said, "I wish I had known these basics before the panic." I smiled and answered, "That is why we teach them. Sometimes what you need isn't another test. It's the right knowledge." Correct information does more than protect the body. It protects sleep, trust, and the bond between two people. And that is what healthcare should restore. Confidence grounded in truth. If your partner asks, I advise you to face the question and answer clearly. When your partner is anxious, do not avoid the conversation. Avoidance grows fear. Clarity shrinks it. Here is the mindset I teach. I care about both of us, so I want to be safe. Say it calmly, with eye contact, and pause so they can breathe. You are not accusing. You are inviting teamwork. Use simple, forward-looking language. Try this. I'd like us to enjoy intimacy without worry. Can we agree on a few habits that protect both of us? Then outline the habits you learned today. No brushing right before or after. Treat mouth sores, use barriers when appropriate, and follow a sensible testing schedule. Small, repeatable steps build confidence faster than promises. Name feelings without blame. I feel nervous when my gums are sore, and I want to wait until they heal. I feel more relaxed when we use a condom or a dental dam. Notice the structure. I feel, I need, clear next step. That keeps the conversation kind and practical. If your partner worries about judgment, reassure them. I'm not here to test you. I'm here to protect us. If they minimize the risk, keep the tone steady. Low risk isn't no risk, and simple steps keep us both comfortable. Agree on boundaries and check-ins. Tonight, let's go slow and stop if anything stings. If we're ever unsure, we'll pause, rinse, and talk. Healthy couples practice safety the same way athletes warm up. Not out of fear, but respect for the body. Silence creates distance, but honesty builds trust. Mature love does not fear the word HIV. It meets the topic with facts, empathy, and a plan. And remember, questions asked early prevent confusion, panic, sleepless nights later. That is how intimacy deepens. Two people choosing courage, one respectful conversation at a time. The safest plan is practical, timed, and repeatable. Testing works when you use the right test at the right time, and when you follow up even if you already feel okay. Here is the timeline I give my patients, with clarity. At 3 to 4 weeks after a potential exposure, request HIV, RNA, or P24 antigen testing. These tests can detect infection earlier by measuring the virus itself or the early protein it produces. If the result is negative, take a breath, then continue. At 6 weeks, take a fourth-generation combo test. This test detects 24 antigen and HIV antibodies, and it is highly reliable at this point for most exposures. If negative again, your risk for that episode is very low. At 3 months, 90 days, repeat the fourth-generation test for final confirmation. Think of this as closing the loop. Most people do not need further testing for that specific event unless a clinician identifies unusual circumstances. Between tests, protect yourself and your partner. Avoid oral contact if you have mouth sores, bleeding gums, or throat infections. Do not brush or use alcohol mouthwash just before or after intimacy. Consider barrier methods and pause when anything stings or bleeds. If you have new partners or new oral, vaginal, or anal activity, schedule routine screening every 3 to 6 months. Screen for other STIs as well, because they change risk by creating microtears and inflammation. If a partner is living with HIV and on effective treatment, remember UQ. When viral load is undetectable, transmission is effectively prevented. One test at the right time is worth more than 10 late regrets. Testing is not a confession of guilt. It is a tool for certainty, sleep, and peace in relationships. Follow the timeline, stay steady and consistent, and let knowledge replace fear. You stayed until the end, so here is the promised answer. The top mistake men make is cleaning too aggressively right before or after oral intimacy. Brushing, flossing, or using alcohol mouthwash that injures the gums and turns a caring act into irritation. The fix is simple and powerful. Rinse gently with water or saline, wait, and let the mouth's natural protection recover. Pair that with presence instead of rushing, and comfort returns, at any age. Now the summary you can carry with you. Saliva does not transmit HIV. Risk changes when open sores, bleeding gums, throat infections, or other STIs create tiny entry points, or when semen or menstrual blood is involved. Low risk is not no risk, so act with calm precision. Testing turns uncertainty into confidence. Use the timeline. RNA or P24 at 3 to 4 weeks, 4th generation combo at 6 weeks, and confirmation at 3 months. If partners are on effective treatment and undetectable, remember, UU. Transmission is effectively prevented. Routine screening protects both health and peace of mind. Emotional safety matters as much as biology. Speak plainly and kindly. I care about both of us, so I want to be safe. Agree on small habits. Barriers when needed, no brushing around intimacy, pausing for any sting or blood, and postponing during mouth or throat problems. Truth and respect make closeness safe. Schedule STI screening every 3 to 6 months with new partners. Keep dental checkups, treat ulcers early, and use dental dams or flavored condoms when needed. Habits keep pleasure and protection traveling together. If this helped you breathe easier today, share it with someone who needs clarity, and subscribe to stay one step ahead of fear. Knowledge doesn't kill romance, it protects it.